really lucky to have Allie with us because she's going to...
Did you read this online yet?
Yeah, I have a...
This is basic health services. These are the three.
You guys want to use the board?
You guys, people...
Do they have here, and then end of the year is to approach, so we want to make sure that it's IH887. And we were also looking into providing incentives for who may not have reached your office.
I'm just going to the website.
And so maybe if we can just get straight down, and if there's something important to cover,
but at least to our knowledge, there is either no reporting or simply very poor.
But then when we would go to seek them, we would just have windows of high
The report that I just did very quickly while you guys were sharing your wishes, we recognize this is again is a political issue. However,
keep track of all of them. We don't have a donor tracking person on our team, but we'd love to be able to know what's going on at the provincial level that are working for us. We have people at the local level that can guide us to the point person that you can speak to and kind of have these key priority areas, these things, put them in place, and by the time they come out, you may have moved on to something else. So in terms of policies, I'm working great, my team is working super hard.
from the citizen perspective, I noticed that discussed very briefly calling incentives and training systems and see what sort of records you guys have on file. We just recently met them when we were respecting their wishes on that. They requested that we the structure of our offices.
Realistically speaking, in order for us to be effective in completing these goals, we need to have a solid management. And not duplicate efforts and know what each person is doing.
So we are building at the medical level, one to the financial level is going to approach either of us. Just give me a call.
For a representative from each
Oh yeah,
one,
that is a very important point. Before you leave, everyone, can I have your attention? So before you leave, we want our big concrete.
We're just trying to break it in.
I know, but I needed one.
So remember that, because that fixed over on this big table and side over the small table. And it's previously mentioned where we were doing case studies.
Thank you. I didn't know that.
If you go into a home, you will most likely improvise. Most likely they will not necessarily have measuring spoons and they will not necessarily have a limber. The 811. But more importantly, you being effective in terms of being absorbed by your cells and the...
So do you know with arranging transportation?
You get to do it twice.
Yeah,
Is it different?
yeah.
The real one makes you bum it.
Proportional growth in cities and their respective...
And then we present them all to each other so we can opportunities for bank loans. So with the Ministry of Finance, the government
By inoculation.
However, despite that, 200. It's estimated that
The problem may be not getting
Whether or not they've been immunized.
Lack of of information about that.
It's a great idea to have songs with your
to get the ball rolling. Yeah, just what you would do to start this all off.
Right, so let's start with what exactly climate.
And all these can lead to maternal and childhood.
And within that statistic, 2.0 and the reporter is going to
Age, which can be used to indicate
fortified with zinc, vitamin A, so it already has the minerals that are needed for the popping nut. And that's what was in the video with the kids were. Yeah.
Wasn't it some sort of
Did we give him a time? I don't know. That's Catherine.
Rock, paper, scissors. Oh, you wanna do that? 1, 2, 3. Chart. Plotting, children on growth chart. Come on, we're getting them. You getting them? Let's see.
You're possibly gonna have had a long relationship, unsure in between, monkey in the middle type section. Okay?
And Sub-Saharan Africa, where we are located, is disproportionately.
The workshops that we've had with you, you will not
Is to go over some treatment
Yeah, because they talk so fast I can't type it.
I don't know. I don't think he thinks it's necessary for me to see a doctor. Very relevant to what we're doing here today. So woefully, sort of, difficult situation, and it'll pass.
And then just to give you a picture of the why.
As a provider, you simply loop the cord over their head.
Maternal survival, we talked about social and clinical determinants that affect both maternal confidence and how they're very useful in executing this.
Strengthen to improve maternal mortality. Our mission is to provide obstetric care when and where women need it. We operate throughout Africa,
Which are the administrational regions are then divided into zones. Zones are further divided into districts or worredas. The districts are then, we have done an overlay of the EMOC facility distribution in the country of Ethiopia. As you can see, community level and the most abundant in number are health posts. Health posts, we want women in Amhara and Ethiopia to actually bring it to a facility. On top of the cultural considerations, we also want health specialists. The focus is on the benefit and the impact of our programs as we
Funds in the event that emergency transport village leaders, and they work together to prepare for potential situations around pregnancy and delivery. There were randomly selected worredas in the West Gojam zone. As we move to rollout, and now Ivan will take you guys through the actual specific impacts of these activities as well as the associated costs.
Thank you, Rebecca. Closely at our budget, you'll see that at least a third of our costs are going to Amhara. In Amhara, the women choose to deliver at their homes because the region has quite complex geographic.
So yes, we work with a number of partners in Amhara. ManHealth, or the maternal and neonatal health in Ethiopia partnership with the facilities, and various banks within Ethiopia. Quality issues within facilities, and this will be able to be mission of our organization. The direction is to
they already established health systems throughout the region, as well as to support emergency obstetric care for women throughout Africa. Alazuma, and I am the health tech advisor.
It does need to be monitored and to ensure that you don't develop it. It's not going to take you 5 minutes. How does he get home? You are in the hospital, got all the drugs you need. It probably took maybe 20 minutes to get into that room from start of pain to end. They knew all of your conditions. They got the drugs that you needed. And one of the leading causes of these maternal deaths is eclampsia. So, get there. She doesn't have a means to get you there. There's no referral system. You're there. But as we are in Kona Jubu districts, it's unlikely that you even got to this facility and it needed to be monitored so that your risk of your pregnancy can be reduced. We're hoping today we can give you some answers, and my colleague, Dr.
but it's about the sequence
So start your TV. EAs earlier.
Yeah.
Incentives for staff. That was one of the things that really kept, as soon as you erase that person, they're not there, and how are you addressing that? So I quickly looked in your, we're also going to focus discussions with the staff to ask them what incentives they need to stay in the building. Not so much on those who's zero right now, and it's when I'm not receiving these stipends.
But without losing.
And I personally am having a lot of background work in gender based violence, really struggle with that. I think going as those 2 or 3 that into the proposal might then bring this up. 4. 1 before girls are shooting. And based on the statistics that I presented in the past, however, despite this policy, that has changed.
Without the resources to make informed choices, adolescent girls have limited means to break.
Aged 10 to 24 years who are participating in a nonprofit organization with a girl-focused partnering with local nonprofit organizations or NPOs. OSHA will address these objectives through an SRH component or SRH education be available to provide guidance and foster open discussion at the NPOs while the program team is not there. By providing our program through NPOs, which girls are already
To collect, organize, and in addition, our programs, and this is due to the fact that we have 2 offices, the main office being in the north, and then our small city will decrease HIV and other STI